Good afternoon, everyone, and thank you for joining us for AltaPoint Health's Friday Forum. I'm Katie Emer, and we are excited to be coming to you for our fourth week now. And as we've said before, each week we are learning and growing with this program. So we're so excited that we've got a new camera and a new microphone we are trying out this week because we've got some great information and we don't want you guys to miss a single thing. This week, our topic is going to be substance use disorders and how that relates to the COVID-19 crisis that we are experiencing right now. And so we have a wonderful guest here with us. We have Ms. Halie Jones. I just went blank, of course. Ms. Halie Jones, who is our Assistant Director of Substance Abuse Services here at AltaPoint Health. So Halie, we thank you so much for being here with us. First, I do want to take a second to say that if you are joining us live here on Facebook, feel free to drop us any questions that you have for Ms. Halie, and we will do our best to get to those before we go off air. If you're catching this on a replay, feel free to call us here at AltaPoint Health at any time. 251-450-2211. We have mental health specialists standing by 24 hours a day to take your call and your questions. So first off, Ms. Halie, let's start off by giving us a little bit of your background in substance abuse and your job here with us at AltaPoint.
Okay. My education started at the University of Alabama, of course, and I received my bachelor's in human development and family studies. When I was there, I actually thought I was going to go into marriage and family therapy. Obviously, I'm not doing that primarily now. But I left the University of Alabama, went to Lee University to receive my master's degree in mental health counseling. While I was at Lee, I did my internship with Bradford Health Services, and that's where the passion for working with individuals that are struggling with substance use really ignited. From there, I got my first real career job with Bradford and Warrior, and worked there for several years. Also worked at a mental health insurance company in Birmingham. And then me and my husband decided to move down to Baldwin County. And about 9 months after moving to Baldwin County, I came across the position here at AltaPoint. I've been with AltaPoint for almost 6 years now. So it's been a thrill.
Well, we are so lucky to have you and all of your wonderful experience here and here with us today.
Yeah.
And so again, what we want to talk about today is, given the COVID-19 crisis that's been going on, the quarantine we've been under, the social distancing that's taking place, tell us what kind of challenges this all poses for people who are struggling with substance use disorders.
Okay. I think the biggest thing to remember is that when it comes to substance use, this is a disease that thrives on isolation. It likes to take people away from those that love them, care about them, can keep an eye on them. And it gets those where they're by themselves because their energy levels are down, they're depressed, they're sad, they don't want to interact with a lot of people. And so one of the biggest challenges that I see, especially with COVID-19, is that it's exacerbated isolation. Before you had someone who was struggling and you had the world around them still going. But now with COVID-19, we're encouraging people to stay home when they can. And so some people, they're already at home. And so now it just compiles on top of that. In addition to that, a lot of people that are in recovery, they've not been able to go to in-person meetings. And so that adaptation has had to happen as far as Zoom 12-step meetings and things like that. And so I think what we're seeing collectively is recovery is having to shift a little bit. It's having to adapt to how our world is having to adapt. If you go into Walmart, you have to stand 6 feet away from the next person. When you're in a meeting, usually you were right up next to someone, and now you're having to take away a little bit from the physical contact. And that's something that I think is really big in recovery, is having that physical contact with other people that are in recovery. So I would say those are probably the biggest challenges, is isolation, learning how to thrive in recovery while you're still semi-isolating.
Do you have any tips for folks who are going through recovery on how they can best handle this situation?
I do. The best tip I have is don't stop reaching out. What we have done at AltaPoint is, even though we've not been able to do groups, we do a lot of telehealth.
Mhm.
And so the cool thing about telehealth is that you can't spread germs over the phone. And so that, to me, that's something that, utilizing telehealth, and then also if they have access to Zoom, to FaceTime, things like that, that way you can actually see someone's face. I know that we do that a lot for family members that don't live close to us.
Mhm.
But I think a lot of times whenever we're trying to get grounded in the situation that we're in, if you're early on in recovery, you need that FaceTime with other people. You need to see them talk about their struggles that they're going through. And then if they're talking to other people in recovery, they can also talk about, I went into the gas station, I saw the beer at the back and I had to leave. And being able to see that person's facial reactions while they're talking to other people is so important, I think. Because sometimes you can't pick that up just by voice. So I think it's very important that, making sure that we keep that contact, even if we're not able to see each other in person, to make sure that we're still reaching out and not allowing our nature, the nature of this disease to keep on isolating us.
And is that something you would share with families of folks going through recovery? If you know you have a loved one that's going through recovery, how much more does that phone call or that Zoom call mean to them right now?
To me, I from everything that I have received as far as feedback from our consumers that we're treating, it's huge because, we're active beings. We weren't created and just us put on this world, like there's more of us than just one person. And so we are beings of wanting to be around other people. And so whenever we have someone that reaches out to us and lets us know, hey, you matter to me, I just want to check to see how you're doing. If anything, even though there's a lot of negative associated with COVID-19 and how it's affected what we do, I think the positive thing is how it's challenged us to reach out more.
Right.
To help us find more creative ways to interact and communicate with others around us. Whereas before we didn't think, have a second thought about calling someone and saying, hey, how are you doing? Now we know, well, I can't just ride down to their house. I'm going to call them or on the FaceTime them to see how they're doing.
Or we're going to set up weekly family Zoom calls.
Yes,
I know, we've kind of done that a lot more and touched base more than we had before COVID-19.
Right. Absolutely.
Yeah. So that's a very good positive. But one of the negatives is that some experts predict that once the COVID-19 calms down and subsides, that there could be a rise in opioid use. From your expertise, what would you say goes into that, and how do you help us understand that?
I think there is a possibility of that. What we have seen, we've not really seen a decline in people needing services. That was one of my concerns that I watched very closely whenever everything started is, if we're not able to contact our consumers when we call them, or are people not coming in for medication assisted treatment, things like that. But what we've seen is that we're actually making more contacts and we're still having people come in. And so even though I think that there is going to be an increase, I don't necessarily see right now, just by what I'm seeing at our office, is a surge. I do think what can possibly happen is that whenever things start opening up more, is that people are going to feel free to go out more.
Right.
And just like with anything, whenever people feel comfortable going out into society and socializing, then they're going to have more opportunities to have contact with other people. And so if you have someone who struggles with an opiate addiction or any kind of addiction, whereas they may have been home and may not have been able to get in touch with the person who normally supplied them,
right,
then that barrier may not be there when all the regulations and barriers kind of go away a little bit.
So once everything lifts, it will be more important than ever to really reach those folks and keep them on the right track.
Absolutely.
Talk about the different services that AltaPoint does provide for substance abuse.
Okay. I'm gonna kind of start at the very beginning because to me that's how my brain works.
I know we have a lot of programs.
Yes.
So.
The first thing is we do an assessment because that determines what level of care that person needs. So if someone is out there and they don't necessarily know if they need just individual therapy or if they need detox or if they need residential, The cool thing is that we have the ability to sit down with them and actually do the assessment, not be biased, and actually look at, okay, where are they really struggling? Where do they need the support? So from there, we can actually determine, okay, can they benefit from a service that we offer, or do they need a service that another
That's wonderful.
facility that is state certified offers? And so from there, if we see that they need something that we offer, the services that we currently offer, we have a level 1 outpatient program. We also have a medication assisted treatment program where we offer methadone, and we also offer Suboxone. And then we also have a level 2.1, which is our intensive outpatient program. Now, the difference between our level 1 and level 2.1 is level 1 is going to be less intensive, and your level 2.1 is going to be more intensive. So as far as level 1s, they're not coming as often, but our level 2.1s are coming more often. And I know that's a lot of 2.1 and 1, but
That's okay.
But basically, what we offer is individual therapy, and we also offer group therapy. And what we have found is that if someone is, whether they're doing medication-assisted treatment or whether they're not doing medication-assisted treatment, when you combine individual therapy and group therapy, that's where the magic happens.
Yeah.
They're able to share what's going on individually if they need to with their therapist, but then they're also able to be around, again, have that community of people around them where they can talk about, okay, this is what I'm experiencing. And when they hear someone else talk, I am too, then they feel, okay, I'm not alone in this world. I'm not the only person that feels this way. So.
Yeah. Okay. That's wonderful that we have such a broad range of services and programs available to folks. And substance use disorders really are just one piece of the pie here at Alta Point Health. And we want to take this time to remind you all that we do have another drive-through job fair coming up next Wednesday. It'll be at our Bayview Professional Associates location. So come on by and check us out. Alta Point has, I think it's 1,600 plus employees. So there really are programs for every different interest, every different level, not only for the consumers, but for the employees as well. So, if you're in one area and you're like, this isn't quite the right fit for me, you could try a different program or a different service. So talk to us a little bit about what you have enjoyed being here for 6 years now.
Okay. What I love is that our company is constantly growing and expanding. It's kind of like a body of water that doesn't have any inflow or outflow. It's just stagnant. And if there's anything I can say about Alta Point is we're not stagnant. I'm very thankful for that, because what that challenges me to do as a supervisor is to constantly grow in what I'm doing and also how I am training my employees. It also shows me when I first started, we didn't have a level 1, and now we do. And so, one thing that I'm very proud of as far as working for Alta Point is that we see what the need is for the community, and then we figure out how we can create it. And a lot of times, even if we don't see the need, but we have a hunch that we might need it, we go ahead and then we see the need there. And so we're very proactive as a company.
It's always growing and always evolving to whatever that need may be.
Yes.
And so I want to take a minute right now. I think we got a question from someone on Facebook. What are some of the warning signs of someone that may need help with substance use?
Okay. For me, I receive a lot of phone calls from family asking that same question. And so what I will do is I'll ask them, are they distancing themselves? And so with COVID-19, we've already got that isolation and social distancing thing going on. But look at their behaviors. What does their history of behaviors look like? Have they always been a very outgoing person and now all of a sudden they're withdrawn? Were they a withdrawn person and now all of a sudden they're outgoing and they're the life of the party?
Right.
How are their behaviors changing? Are you seeing them change as far as their sleeping patterns, which with COVID-19, you have to take all of that into consideration. But I think you just got to trust that gut. Like if you feel like something is off, that's usually a good indicator that something, it may not be anything, but a lot of times our gut does not prove us wrong. I tell people to look at the pupils, because a lot of times, if someone is using, their pupils can either be dilated or they can be restricted.
Okay.
And so that's another thing. Some of the simple, I would
Mhm.
call it, warning signs. Just look at their behaviors, look at their facial expressions, look at how their body is changing. And if you see some significant differences, and it's okay to follow that hunch.
What would you say is the best way to approach someone about this issue and help guide them towards seeking help?
I think the best way, I've had a lot of families say, well, I told him he was a drug addict. I was like, don't do that.
Mhm.
Because nobody wants to be called a drug addict or an
Right.
alcoholic.
Mhm.
The best way to approach it is to be honest, but also be mindful. How would you want to be approached if you were in that situation? So I've instructed some families that have called me is to say, just say, hey, I have some concerns. And don't go into the conversation having an agenda.
Mhm.
Just go into it saying, hey, I have these concerns. Is there anything going on?
Mhm.
And don't be alarmed if they say no, nothing's going on.
Mhm.
Because a lot of times
Right.
they may be the last person to admit that something is going on. But just opening that conversation and saying, hey, I'm concerned about you. Is anything going on?
Okay. So perfect.
Yeah.
Well, thank you for that wonderful advice. Do you have any final thoughts that you'd like to share with our folks today?
I think it's so important just to stay focused on the positive. There's so much negativity and there's so much chaos going on all around us at all times. So one thing that I tell my kids every day is let's focus on the positive. What can we do today to make our world a better world today? And a lot of times it's just being kind. So
Perfect. All right. Well, thank you, Halie, so much for being here with us today. And thank you all for joining us online and watching this video. We hope that you have taken away something very valuable. And we hope you'll continue to join us here on these Friday forums with Alta Point Health. Again, we just want to make sure that you all know Alta Point Health is here for you during this time of need. Again, our phone number is 251-450-2211, and our website is altapoint.org. You can also follow us on Facebook as well for the latest information. Thanks, everybody. Have a wonderful weekend.